One of the most famous roots of our province is public health care. We are, after all, the birthplace of Medicare. But ladies and gentlemen, at the risk of being just a little bit partisan tonight, I want to tell you that the health care situation we inherited 3.5 years ago needed more than laurels from the past. You see, the claim that this is the birthplace of Medicare doesn't seem all that important if you're short 800 nurses and beds are closing. And it's not really that important that this was the birthplace of Medicare if we have the longest wait lists for surgery in the country. If the College of Medicine at our prized University of Saskatchewan is under probation. So we've set out to make a difference. We've set out to deal with these challenges. We've kept our promise by adding 40 new training seats at the College of Medicine to train 40 more doctors. We've kept our promise to double the number of residency positions in this province from 60 to 120. If we have more residents, we have a better chance of retaining them in the province to practice here. We've established the physician recruitment agency, and today there are 228 more doctors practicing in Saskatchewan than there were 4 years ago, and we know there's work yet to be done. We've exceeded our commitment to have 800 more nurses practicing in the province, and those beds reopened. We're at about 840. Though when we made the promise in the campaign, many said it simply couldn't be done. We've increased funding for the Cancer Agency by 55%, and we've launched a surgical wait times initiative that really is the talk of the country, especially in healthcare circles. We focused on providing surgeries for the people in this province within 3 months, and we'll get to that objective by 2014, and we are on track to keep that promise. We're going to use regional centers. We will use private clinics within the public system to get people that surgery. I remember last fall I was approached by a gentleman from Yorkton after a speech in that great city, and he told me that he had seen his doctor, and his doctor told him that he needed knee surgery, and so he asked his doctor, well, when will that happen? And his doctor said, November. This was last September, and so he said to the doctor, okay, 14 months, November to 11, I guess it can wait till then. Because that's been the wait times for some of these surgeries. And the doctor said, no, I mean November in 2 months. You'll be at a private clinic within the public system because the government's trying to reduce this backlog of surgeries. Because, ladies and gentlemen, I believe, and I think you believe, that that gentleman in Yorkton would rather have surgery than ideology. He would rather... Some people call it privatization. We have a longer name for it. We call it getting your surgery more quickly within the public system, but perhaps by a private provider. It's kind of catchy. It's kind of catchy. We in this province, notwithstanding who the government is that you have chosen, we must never be satisfied to live off some past glory of the history of healthcare in this country or in this province. We will need to innovate. We're going to need to reduce wait times in this province. We're going to have to work with partners, faith-based partners, private partners, and others. And I'll tell you, ladies and gentlemen, honestly, I don't know of a group more suited to do that than the current Minister of Health and the team that you have put in Regina.